demonstrate some of the specialized equipment and tools that we use for handling one of my favorite populations to serve. That's pregnant mamas and little babies. So these are what are called pregnancy pillows. These help us check the pregnant woman to ensure that her pelvis is straight, because we want her pelvis to be on straight to accommodate the child and make sure that it can turn appropriately. Because if the pelvis is crooked, the baby may have an issue turning, getting ready to be born. So we have two different pillows here. One is a very thin one, and this is for the very first stage of pregnancy where she's just starting to show a little bit, and we don't want to put any pressure on the belly, so it has a cutout, a cutout. As she progresses, we'll start to use the larger pillow, which is just a little bit thicker. Same sort of scenario, it's got the inside cut out. And as we get toward the 8th, 9th month, we'll use both of them. And very simply, they'll go onto the table. She'll put her belly right into here, and that will make sure that no pressure is put on the baby while we check the lower back and pelvis. And here we have Caroline, and although she's not pregnant at the time, we're going to have her demonstrate how to lay onto the pregnancy pillows. She used them all throughout her pregnancy. So what she'll do is she'll climb up onto the end of the table on her knees. She'll position the pregnancy pillows so that her belly button is right in the middle. She'll aim her face for the head paper, and then her arms go down to the armrest. And now she's in a really comfortable position. The baby is well supported, and we'd be able to take a look where her pelvis is to make sure that it's in alignment. And now what we're going to do is we're going to check her alignment. The first thing I do is make sure nothing's bunched up. I'll make sure she's positioned onto the pillows really well. We'll look at her leg length. If one leg is shorter than the other, then that would show us that one of the hips is tilted up or rotated. So then we'll come up to the hips to see if one of them is tilted up and rotated. If they are, that's going to be the hip that we want to level out and realign. I'll then bend the knees very gently and flex the knees to see if there's any resistance on one side or the other. And that would give us another indicator as to whether the pelvis was locked up in malposition.